Hello, I'm Rick Hours, and this is FYI. Today, for your information, there is a disorder that affects millions of Americans and keeps them from getting a good night's sleep. It's called sleep apnea. With me today is Jill Baker, Director of Clinical Education for Respiratory Therapy at Shenandoah University. And Jill, just what exactly is sleep apnea?
It's a disorder that when you fall asleep, your throat, the soft tissues in your throat fall together. And then when you try to breathe in, the air can't pass because the tissues are blocking the air passages, and then you wake up. And that can happen millions of times during the night. And the oxygen levels in your blood fall. And so your heart doesn't get enough oxygen, and that can lead to all kinds of problems.
What are some of the problems that it can lead to?
It can lead to high blood pressure. There's been a direct link between obstructive sleep apnea and heart disease, and also it can lead to daytime sleepiness, car accidents. Highway Patrol considers sleepiness just as destructive as being under the influence of alcohol.
Are there particular characteristics about us that cause sleep apnea?
There are. The typical person with sleep apnea is over 40, overweight, and male. But females can have it too, and also children. So there are a few questions that you can ask yourself to see if you do have sleep apnea. One is, do you snore, or has anybody ever heard you snore? Also, has anybody ever heard you choke when you were sleeping? Also, do you fall asleep during the day if you sit down?
Now, what is the treatment, or is there a cure for sleep apnea?
There's no cure, but there is a treatment that works very, very well, and it's called CPAP or bilevel therapy, where CPAP is what's called, it's a little machine that's about the size of a small lunchbox, and it has what's called an expiratory pressure, and that pressure helps to keep the airway open when you sleep. And it uses a small nasal mask. It's very comfortable and very effective. So, and they will use that to see if it works for you right there in the sleep lab. So, and it works in most cases. There's also surgical procedures that you can use in dental appliances, and the doctor will discuss all of those options with you.